Okay, so so welcome everybody. This, as we said, is sort of part two to the thyroid and nutrition talks that we've done. I talked about who I am in part one, so I'm not going to go into this in huge detail. But just for those of you who don't know, I'm a functional medicine practitioner. I'm a certified functional medicine practitioner, and I'm a registered nutritional therapy practitioner, and I'm a registered nutritionist. I also have a podcast called the Goode Health Podcast. There are loads of thyroid episodes on there, so that might be something you want to jump over and have a look at. I have my own clinic, the Goode Health Clinic, and this year I also published a book. I say this year, it actually has only came out a couple of weeks ago, so that's been the new thing that's been going on. So a little bit about me. I know we did this in the first one, and you guys can catch up on that. My history, my background comes from my own journey with autoimmunity. So I don't have thyroid, but I heavily work with thyroid now. I think it's one of the most underserved autoimmune conditions in the medical world, and clinic is full of it. But I have autoimmunity. I've been on that journey, so I understand what that's like. For those of you who do have the autoimmune thyroid, of course. So I'm not going to run through my whole story because we've done it on the previous one. We did also talk about what functional medicine is, and I'm going to just do this again in a sort of more condensed form, just so that you guys listening tonight can just understand what it's about and how it differs to conventional medicine. So functional medicine is a whole body root cause approach to medicine. And with the root cause, what we do is we're asking why, not what. So instead of sort of saying, what have you got? You've got a headache. Here's a painkiller to mask the pain. In functional medicine, we're asking why. So we're saying, why has a person got a headache? And for different people, those reasons will be different. So for some people, it could be a hormone imbalance. For others, it could be a nutrient deficiency. There could be toxic overload. There could be mold. There could be viral load. So everybody would be a bit different. And therefore, everybody with a headache could be on a completely different plan. So that's the idea behind root cause medicine, is rather than sort of treating the symptom, we're saying why somebody got that and what can we do to balance the body out so that you don't get the symptom in the first place. The whole body obviously means we look at the whole interconnected body, how each system impacts each other, and the idea that your thyroid, for example, isn't just impacting your thyroid, it might be impacting your mitochondria, your adrenals, your brain, your endocrine system. And I mean, that's probably a whole other talk, is how the thyroid impacts different parts of the body. But it is the core concept behind my book. And I work with so much thyroid that so many people have asked me why I didn't write a thyroid book. And the reason was because we can't just work on thyroid. We need to work on the whole body. We need to work on everything that the thyroid interconnects with as well. So functional medicine is whole body, it's root cause, it's also personalized. So it's making sure that each individual has a different protocol, based on your genetics, your health history, your lifestyle, and then we build those plans out for you. And it's also really proactive. So it really focuses on you being an active participant in your healthcare. And whilst that is more work for you rather than just being given a pill and taking it, it's also very empowering. It really does help if you can be an active part of your healthcare and you feel like you're doing something to support yourself. So thyroid and autoimmune, I work, 90% of hypothyroid cases are Hashimoto's, even if people don't necessarily always know that they have Hashimoto's, because a lot of people are not told. But 90% of hypothyroid cases are Hashimoto's. It's a little bit less when we're looking at hyper and Graves. Once you've got one autoimmune disease, the average is that you will get 5 over your lifetime. So we do start collecting them because of that immune dysregulation, which is why it's really important to work on that, on your immune health, as well as working just on your thyroid. If you have Hashis or Graves, then you need to work on both sides of that coin, the thyroid health and the autoimmunity. The rate of autoimmune growth is 9 to 12% a year, and thyroid tends to lean on the higher side of that. It doesn't sound a lot, but if you do the figures, that's growing by millions a year. So it is a significant amount. Most things are growing at around 1 to 2%. So it's a significant growth. The most common endocrine disorder in the world is actually hypothyroidism. And the most common autoimmune condition in the world is Hashimoto's. And levothyroxine is always in the top 10, and most years it's in the top 5 for the most prescribed drug around the world. So, thyroid really is a huge problem. if you have thyroid autoimmunity as well, just again, that point that if you've got autoimmunity, you've probably got it to another part of the body as well, even if you don't yet know about it. So what we were looking at in part one, we're doing a whistle-stop tour of nutrition for thyroid. So in part one, we looked at these first 5 points. We looked at gluten, dairy, anti-inflammatory foods, diversity, and blood sugar balance. And today we're going to dig into the next 5. So we're looking at iodine, goitrogens, selenium, lectins and nightshades, and salt. So that's what we're going to look at today. And I'm going to kick off with the most controversial area. So we're not going to ease in. So iodine. So this is a big one. It's also a very, very controversial one. And we are with iodine talking a little bit more specifically. A lot of these nutrition things that we're talking about, it doesn't matter whether you're hypo, hyper, Hashis or Graves. They apply to everything. With iodine, we're a little bit more specifically talking about the autoimmune thyroid diseases, so Graves and Hashis. But as you will see as we go through, there is still some research that suggests that it applies to hypo and hyper as well. So iodine, there is a mass of research against using iodine in Hashimoto's. And that also implies for Graves, because some of the research, a lot of the research is done into Hashis, and you'll probably hear me say Hashis quite a bit because a lot of the research has been done into that because it's the most common thyroid condition. A lot of it has been done into autoimmune thyroid, so Hashis or Graves, and as you'll see, some has been done into hypo and hyper. But there is a massive research against using iodine, and this is a real problem because a lot of thyroid supplements that promote themselves as thyroid supplements contain iodine. And this is not just a patient problem, this is a practitioner problem. There are still practitioners who are promoting the use of iodine, and this is really concerning. If we look at Hashimoto's specifically, we know that Hashimoto's is not caused by an iodine deficiency. So instead with Hashimoto's, what is happening is your follicular cells are actually being damaged by the autoimmune processes that are going on in the body. And iodine actually flares up those processes. So it's actually flaring up the damage to the thyroid cells. And what we need to remember is with Hashis and with Graves, they are autoimmune disorders. So where the body's immune system is mistakenly attacking the thyroid gland, it's leading to that chronic inflammation and then more thyroid dysfunction. And the problem is that autoimmune disorders are often very misunderstood by mainstream medicine and also by practitioners who have not had specific postgrad training to have that really in-depth knowledge of the processes and also the latest research. So historically, we did use iodine in thyroid care, and this dates back to around the 1950s. And that was when it really became kind of known that iodine was involved in the thyroid, that maybe if we give iodine, that's going to help. And that's where it came from. However, we now understand that this is a really outdated practice, and it's actually a potentially harmful practice. So my mentor, he's the top of his field, he's an immunologist in the USA, and he actually does a lot of the research papers now himself. Some of his research papers are some of the top in the world. He is now so clear on the research that he says that practitioners who are giving iodine to Hashis patients are actually committing medical malpractice. Now, it's not medical malpractice. You won't be able to sue them because it's not in the law, but he deems it as such because the research and the science now is so specific about this. And while iodine is really necessary for that thyroid hormone synthesis, so to produce those thyroid hormones, using iodine supplements or iodized salt to address thyroid issues is not recommended, especially even more so in Hashimoto's and Graves, but really in any thyroid condition there's growing concern. So you really should get your iodine from your diet. So we're looking at fish, seafood, and eggs. And actually, it's been now seen in the science, in the research, that a low iodine diet is actually recommended when antibodies remain stubbornly high. So if we've got somebody where we're really struggling to get those antibodies down, then actually an iodine restriction diet can be beneficial. So why has this area kind of become controversial? A lot of it is just that practitioners are not reading up on the new science. And some people initially do feel better when they take iodine. So some practitioners who are not as knowledgeable as we would like them to be will give iodine to a patient. They will feel better temporarily, and so they think they've done their job. What is actually happening is that you have the iodine initially, so you're producing more thyroid hormones and more will be released into your circulation. So you will show some signs of improvement. But over time, that actually causes more follicular cell damage, and that damage is permanent, and you will feel worse. So the permanent damage comes later. And that's where this gets really tricky, because initially you can feel better on the iodine, but over time that's going to cause more damage and it's going to cause you more problems further down the track. So if you really feel like you're trying everything, nothing's improving, then restricted iodine diet can be tried. That's something that we do use now. But the evidence now really strongly indicates that iodine can in fact trigger flare-ups, especially in those autoimmune conditions. But as I said, that the science is coming through for all the thyroid conditions now. Now, I don't normally go kind of too science heavy in these talks, but this is such a controversial area that I know you will come across practitioners who will tell you that you should have iodine. So I want to just show you, and we're going to just kind of whistle stop through a few of these. I just want to show you some of the research papers rather than me sitting here and sort of saying I'm right and other practitioners are wrong. I want you to see the science and see that the papers are out there. The research is out there for this. So I actually put some of these slides together for a talk that I did specifically on iodine and thyroid. So, we spent a whole hour talking about this. So there's a lot of them, and I'm just going to go through a few of them here. But I do just want to kind of show you this. So this one says excessive iodine intake is well-established environmental factor for triggering thyroid autoimmunity. So here, this one specifically looked at Hashis or Graves. And excessive in this paper was classed as anything outside of dietary intake. So anything outside of just eating normal levels of fish, seafood, and eggs. The next one, we've got iodinated thyroglobulin is responsible for triggering the autoimmune process due to long-term immunomodulatory effects of iodine, as reported to occur in populations exposed to prolonged iodine supplementation. So iodine works at the pathway in the thyroid where you get the autoimmune reaction and therefore that TPO activation. And you probably recognize TPO from the TPO antibodies that we measure. Well, we hopefully measure and monitor in your blood. You can't always get them from your GP that easily, but hopefully you are getting your antibodies checked and you know what sort of the levels are for those. But here, what it is saying is that iodine is actually triggering that inflammatory response that is causing damage to those thyroid follicular cells. And that damage to the thyroid is what's causing the thyroid to then not be able to function properly over time. So again, you may feel better initially, but over time, you're going to have more damage to your thyroid and you're going to feel worse. So this one, excessive iodine promotes pyroptosis of thyroid follicular cells. Pyroptosis just means pro-inflammatory cell death. So you may have heard of apoptosis, which just means cell death. Pyroptosis just means that there's been an inflammation that's caused the cell death. And that's all that is. Excessive iodine is causing that inflammation that is causing cells to die in the thyroid. And that's what this paper is saying. So this one was actually done on hypothyroidism. So I've tried to get a couple in there that are not just Hashis and Graves, because I appreciate that people may be may have different conditions, obviously, listening to this. So iodine is an essential component of thyroid hormones. Either low or high intake may lead to thyroid disease. We observed an increase in the prevalence of hypothyroidism, subclinical hypothyroidism, so that's people that haven't even reached the point of diagnosis yet, and autoimmune thyroiditis with increasing iodine intake. So as they increased iodine intake, the prevalence of hypothyroidism, subclinical hypothyroidism, or autoimmune thyroiditis got worse. And that was just with adequate or excessive. So again, just anything more than what you would get from eating a regular amount of fish, seafood, eggs. This one concluded that high iodine intake was likely to lead to the occurrence of thyroid diseases such as Hashimoto's, goiters as well. So it's been linked to that too. Hyperthyroidism as well, again through a long-term mechanism. So again, showing that there is this initial, you may feel better initially, and then over time, it's going to cause that damage and feel worse. Again, more than adequate iodine intake could be a public health concern. So, I mean, that's getting pretty serious when we're getting to public health concern levels. That one was in China. This paper was in Britain. So dietary iodine intakes of 750 micrograms a day or more may adversely affect thyroid function. And this was in people with borderline hypothyroidism. So these people are not even diagnosed with a thyroid condition, but it actually could make their thyroid function worse. And that's in somebody who's not reached clinical state yet. So in somebody who has reached clinical state, that's going to be much worse. And then this one, 1999, Slovenia increased iodine content. So they actually, in Slovenia, what they actually did was they actually increased the iodine content in kitchen salt, and they moved it from 10 milligrams to 25 milligrams. And what they found was that the incidence of Hashimoto's doubled in Slovenia, just because they'd increased the amount of iodine in the salt that was sold in the shops. And this really as well, this is 1999. So this shows, I'm saying the new science. This has been around for a long time, where, there's 30 years or more worth of these research papers. The old science would be classed as sort of the 1950s. So the practitioners who are still promoting iodine really are working back to that sort of 1950s science. And medicine moves very quickly. We have to stay up to date with the new and the latest research. There's also been research into the iodine restriction as a diet, as I said. So this one showed that 78% of people with Hashis in this study actually returned to normal thyroid function on iodine restriction diet within 3 months. And those who didn't, 22% were getting lower levels over time, and that was expected to continue, and that they would become euthyroid, which just means normal thyroid function, over a bit more time. So they just needed longer than 3 months. Everybody's was dropping. So everybody's TSH levels were coming back to normal. 78% of those were back to normal within 3 months. So there's significant reason to look at iodine restrictive diets. So this one, iodine restriction may normalize or at the very least decrease serum TSH levels. And again, this was subclinical thyroid. So again, not even people with, with a thyroid condition. And the last one, and I will stop boring you with the science. 33 consecutive hypothyroid patients with a median age of 52 without a history of destructive thyroiditis. So they weren't necessarily getting damage to the thyroid. Within 1 year, were asked to refrain from taking any iodine containing drugs and foods. And 63% of those people that had a 50% decrease in their TSH levels, and 33% became normal, so euthyroid. So there really is no excuse for not knowing about this now. This is 30 years worth of research. Just because you feel well initially when you increase iodine is not a reason to ignore the science. And the goal is long-term health. It's always long-term health, not short-term vanity. We don't want short-term wins. We want what's going to keep you well for longer. I would much rather you come to me to work with me and say, I'd much rather be able to say to you, you will feel better in 3 to 6 months and actually do you some good, than be able to say to you, look, I'll make you feel better in a week, but actually what I'm doing is giving you a false sense of feeling better in a week and actually doing long-term harm. So it's really important that we do know about this. Louise, yeah.
I've got a question for you already, Nicole.
Yeah, go on.
The question is sea salt naturally iodine free?
Not necessarily, no. Okay. So as I generally would say with everything, check packs. They will say they will say what iodine is in. So just read the packets. But it's not necessarily a case of if you buy sea salt, it will be iodine free. You need to read the packs and check.
Okay, thank you.
Okay, so I know we've dug into the science probably a little bit more than I would do normally in something like this, but it is really controversial area around thyroid, and I think it is really important that you see for yourselves that the research is out there, and you're not just believing me when if I'm contradicting other people, but that you can actually see what is out there and make an informed choice for yourself. So I do think on this particular area, it is really important to see that science. Okay, so let's move on. So the next one we've got, number 7, is goitrons. Now this might be one that you've heard of. And we have food goitrons and we have chemical goitrons. And goitrons are linked to the thyroid and to iodine as well, actually. But they are They're defined as substances that disrupt the production of thyroid hormones, and they do it by interfering with the uptake of iodine into the thyroid gland. So what happens then is the pituitary in the brain releases TSH, and it promotes the growth of thyroid tissue, and this can lead to a goiter, hence why they're called goitrogens. So what is important to note is there are food goitrogens and there are chemical goitrogens, and we need to look at these separately because they are very, very different things. And again, food goitrogens are a little bit of a controversial area. We're doing a lot of controversy tonight, but let's start with the food goitrogens, and then we'll look at the chemical. So food goitrogens, you will still see practitioners who are recommending that you avoid food goitrogens. And to be fair, in this area, it is becoming a lot less common. So I don't know. I know a lot of practitioners. I don't know anybody now that recommends that you avoid goitrogens, but I'm sure there are still some out there that are doing so. What has happened here is that some studies were done originally in a test tube, and the results of those showed that actually goitrogens had an impact, and we shouldn't be eating food. Well, you shouldn't be eating food goitrogens if you've got a thyroid condition. But the latest research, so again, if we get up to date with the science, has actually been done in humans. And this shows that the same problems of inhibiting the iodine uptake into cells, it's not occurring in the human body. And there's actually huge benefits to thyroid patients from the nutrients that are in the goitrogenic foods. So goitrogenic foods are things like your cruciferous veg, soy, cassava, lima beans, lentils, sauerkraut, sweet potato, cabbage, kale, all these foods, they're so good for you. They've got so many good nutrients in them. And one study they actually tested a broccoli drink. So broccoli is a goitrogen, and they just made a drink out of broccoli. And they found no impact at all in the human body to iodine uptake, but they found huge benefits to the inflammation in the body. So goitrogenic foods were actually found that not to cause the goiter. They don't disrupt that T3, T4 in vivo in the human body. They do in vitro in the test tube. And this is where sometimes you will get a bit of a mix up with information. So if you're reading information out there and you read a bit, that usually is where that mix up is coming from. The earlier studies, obviously they do things in test tube first. So the earlier studies in test tubes did find a problem. And then as the science has been done and it's moved to in vivo in the human body, they found that it just doesn't have the same impact in the human body. And there is these huge health benefits to eating them. So food goitrogens actually increase the glutathione levels in the body. And glutathione is your master antioxidant. So it protects you against oxidative stress. And oxidative stress is like the body's version of rust. So every chemical process that goes on in the body, there is a byproduct that is made, and the result of that is oxidative stress, which is effectively just rust in the body. We clean that up with antioxidants. So that's how we clean that up. And glutathione is your master antioxidant. So elevating glutathione, really important in thyroid patients, and it helps to protect the thyroid from damage, the thyroid tissue from damage. It's also important in autoimmune thyroid, so it really helps as well with the immune function. So goitrogenic foods help with excessive iodine uptake in the thyroid. It also turns on glutathione levels, so it's turning on all those really anti-inflammatory, antioxidant properties. And it doesn't compete with iodine to the point that it's going to impact your thyroid hormone production. Food goitrogens, the other thing we know about them is they're also typically deactivated during cooking or during digestion. So additionally to the fact that the science now shows this is not happening in the human body, we're also seeing that if you cook them or when you digest them, the compounds in the foods are usually broken down to such a low level that they wouldn't cause harm anyway. So you do want to consume some goitrogenic foods because they've got a lot of positive benefits for you. Chemical goitrogens, whole other issue. So chemical goitrogens interfere with the thyroid gland's function by blocking the uptake of iodine. So exactly the same. They inhibit that synthesis, thyroid hormone synthesis. And the substances, so things, there's so many of these, but things like all things that you'll have heard of in your beauty products and things like that, where we sort of say, oh, we want like phthalate 3 and percolate 3 and all this sort of stuff. They all disrupt the normal processes of iodine uptake and thyroid hormone production. And they've shown that the chemical goitrons do this in the human body. They are toxins and we don't want to put them in the body. So even if for anybody, we don't want to put them in the body, but even more so if you've got something like a thyroid issue, which is part of the endocrine system, and we know that these chemicals disrupt that endocrine system, it's going to be even more important for you. And they do have a significant impact. And they're found in things like environmental pollutants, cosmetics, cleaning products, even some medications or supplements. So the thing with medications and supplements is quality. It's making sure that you're getting the good quality stuff. And then with the environmental pollutants, the cosmetics, cleaning products, it's really it's cleaning up your skincare and cleaning up the brands that you're using in your home. But the impact of goitrogenic chemicals can be more pronounced and potentially harmful for thyroid health than it is for the average person. And we know they impact the average person anyway. The other thing is they don't have any of the health benefits attached to the food ones. So there is zero health benefits to having these chemicals in your environment. So that is goitrogens. So number 8 is selenium. I'm just going to have a sip of water because I'm doing a lot of talking. So number 8, selenium. So selenium plays a really crucial role in thyroid health. It's an essential mineral that is required for the production of thyroid hormones. And these hormones are really vital for regulating your metabolism, your growth, your energy levels. So they're involved in so much. And selenium is a really key component of enzymes involved in the conversion of T4 to its active form T3 in the thyroid gland. So I think we maybe did touch on this in the first one, but I'll just sort of briefly run through this again. Your thyroid produces 90% in T4 of the thyroid hormone is produced in T4 format. So of all the hormone that your thyroid produces, 90% of it is going to be produced is T4. And that needs to be converted to T3 because T3 is the version that your body can actually take up. It's bioavailable to the body. So it's really important that that process happens. Selenium is a really key component in that conversion. And sometimes I know we talked about this in the first one, but sometimes the issue where your medications, your levothyroxines are helping to get your TSH levels balanced. Sometimes actually the thing that is stopping somebody from getting better is further down that thyroid pathway. So the TSH may get balanced with the medication, but you may be then producing enough thyroid hormone, but you're actually not converting very well. So you're producing plenty of T4, but it can't be used by the body. And if you're not converting well, you're not making enough T3, your body's not getting enough of the thyroid hormone, even if that TSH level has become balanced. So this is where we need to look beyond just medication and look at what else we can be doing. So selenium, really important for that conversion. So therefore it's necessary if we're going to have optimal thyroid function. And people with thyroid conditions may benefit from selenium supplementation. It can really help to reduce inflammation. So if you've got an autoimmune thyroid condition, there's added benefit there as well as supporting that thyroid hormone synthesis. It also potentially, we do see people have alleviation of symptoms if we increase selenium levels. You can do this through food, so you can incorporate selenium-rich foods into the diet. It's a very effective way to ensure that you're getting enough in there. So long as you are digesting food okay, and this is where gut health ties in, so long as you are uptaking nutrients well and your digestion is good and you're actually getting enough of these nutrients out of the foods that you're eating, you should be able to get enough from diet. It's foods such as Brazil nuts, seafood, particularly things like tuna, halibut, sardines. They're very, very sort of high in selenium. Eggs, sunflower seeds, mushrooms, all really excellent sources. It is important to make sure that we maintain a balance. It's very easy to get excessive selenium when we become aware that we need it. We actually only need 2 Brazil nuts a day to give us all the selenium that we need. So sometimes, people read that, Brazil nuts are high in selenium and you need selenium, and they'll come to me and they're eating, a bag full of Brazil nuts. We actually only need 2. So everything always in balance. But we do definitely need selenium in the diet, really important. Okay. What's number 9? Number 9, lectins and nightshades. Okay. So we'll deal with these separately. We'll start with lectins. So lectins are found in things like your nuts, your seeds, your grains. Lectins can actually cause cross-reactivity in people, especially those with the autoimmune thyroid conditions. And this is slightly linked into gluten that we talked about in the first part of this talk. But one of the things that lectins can actually cross-react with is the TPO, so the antibodies that are made against lectins combined to your TPO antibodies in the thyroid gland. Now, one component of gluten is something called wheat germ agglutinin, and this is part of lectin. So it's part of these lectins foods. And this is why some people will say, oh, I got tested for gluten and I was absolutely fine. So I don't know why you're saying I need to cut gluten out. They may have been tested for gluten because a lot of the food allergy tests, which are not brilliant, to be honest, we don't use them, will have said that gluten's absolutely fine because it doesn't test for all the different parts of gluten, and it doesn't test for wheat germ agglutinin. And actually that's the part that you can often have a problem with. And this is why, so in clinic, I use autoantibody testing against food. So we can look at the different parts, we break it down and we look at which parts of food you might be reacting to. But this is why some people will say, oh, you know, allergy testing, I didn't come up for gluten, I don't need to eat, I don't need to cut it out. You may not be reacting to gluten as a whole, but you may be reacting to wheat germ agglutinin. If you are reacting to wheat germ agglutinin, you will also be reacting to lectins. So we do this because it's important to make sure that we are taking out anything that is triggering flare-ups for you, because that's how we're going to keep you well for longer. Not everybody is going to need to cut these foods out. So this is where, again, it becomes personalized. And this is where functional medicine really does come into its own, because it's not the case for everybody. Some people will be absolutely fine with lectins. Others will react. We can do testing, or we can do an elimination diet, which needs to be done in a very specific way to get true results. But if we do it properly, we can do an elimination diet, or we can do testing. But really important that, you know, we want as diverse a diet as possible for our gut health. So we want to cut as few foods out of the diet as we can. We don't want to cut everything out. In fact, the people that I find that come to me in the worst possible state are usually ones who have cut out all the foods that they've read about for thyroid or any condition, and they've cut everything out, and actually they're feeling worse. We want to cut as little as possible out. So we only want to cut these out if you have a problem with them. But the foods, things like beans, chickpeas, lentils, peas, soybeans, the nuts like almonds and cashews, seeds like sunflower and sesame, rice, quinoa, all of these sorts of things, even some things like tomatoes, potato, aubergine as well, they would all be classed as lectins as well. So lots of really good foods, and we don't want to cut them out unless we absolutely have to. But it is really important to note that some people with thyroid are more prone to having that problem with that wheat germ agglutinin, which is that part of the lectin. Okay, so nightshades. Nightshades are a group of plants. Commonly, we're consuming those in vegetables. So it's things like tomatoes, potatoes, peppers, aubergine. And some people, specifically those with autoimmune conditions, so we tend to find this is more of a problem for people with Hashis or Graves than it is for hypo or hyper. Some of them, and again, some, not all, may need to consider eliminating nightshades from the diet. And this is more to do with concerns over inflammation and immune responses to nightshades. And that's why it's less important for people with hypo or hyperthyroid, and more important for those with Hashis or Graves. So we do need to look at that relationship between nightshades and autoimmune conditions. It is very complex. It is very individual as well. So there's very individual responses to, and it can really vary. So we don't just as standard remove nightshades from the diet. Again, they contain a lot of goodness. They contain a lot of nutrients. They add that diversity to the diet. They help with gut health. So there's lots of reasons to keep them in. But if after sort of, we've looked at gluten and dairy, we've worked on diversity of the diet, we're really not seeing improvement, we've dealt with some of the other things like the selenium and the iodine and things like that, then at that point we might say, okay, we need to look at nightshades, we need to look at lectins, and again, we can run elimination, or we can do testing to see what's going on for you as an individual and help to build that personalized plan. But there's certainly not things that you should just be saying, oh, I'm going to just cut everything out of the diet and hope for the best, because you will damage your gut health, and we know that damaged gut health is just going to make everything worse. Okay, and number 10, so salt. So salt actually activates a pathway which turns on what we call Th17 cells, which are immune cells. And so it turns on Th17 and it down-regulates T regulatory cells. So these are all immune cells. And the T17 cells are inflammatory. So salt is actually activating that pathway that's going to turn on that inflammatory pathway of T17. At the same time, it's turning off the T regulatory cells, which are the ones that maintain balance between pro-inflammatory and anti-inflammatory. So you're upregulating inflammation and you're turning off the stuff that's going to help balance out the inflammatory versus anti-inflammatory. So again, a little bit more of a concern in Hashis and Graves here in the autoimmune conditions because of that inflammation and the immune system connection. But we don't want inflammation in anybody's body. It will make immune function worse. Yeah, so if we're turning on that pathway and down regulating the things that are balancing the pathways out, then there is that potential for inflammation just to be left and be kind of running riot. So we don't need to not eat salt ever. It's a case of limiting salt, not having really salty foods, not having a really salty meal. If you do have a really salty meal, try and eat something with potassium in it. Potassium really helps to balance out the salt. You can take a potassium. Some people do, if they particularly have a problem with this, do take a potassium supplement if they have a particularly salty meal. I wouldn't advise that you do that all the time, but if it's a one-off and it helps, then that's fine. But always check with a practitioner first before doing that. Make sure you know what you're doing. But trying to eat potassium foods if you're having a salty meal, that is also going to help. So what next? That's the end of the 10 points. I mean, this has been a sort of a whistle-stop tour. I know we've mentioned sort of the thyroid and its connections around the body, and that really is a whole other talk that we can maybe look at in 2025. But the really important thing to remember is the reason that people don't see benefits, the most common thing is not getting to the root cause, missing an underlying imbalance, not working on the autoimmunity. If you've got the autoimmune disease, you're just working on the thyroid, not working on the immune function. Sometimes it can be doing things in an order that needs to change. We need to do things in a different order to help you. Sometimes it's as simple as you're doing too much, reading everything, cutting everything out, and not just doing the things that you need to do for you as an individual. So that sort of personalized medicine really is key. Again, next steps. As I said, my book was out last month, so you can go and grab a copy of that now. It's in all bookstores everywhere. You can listen to the podcast. There's loads of free episodes on there, loads on thyroid, and there'll be lots more to come in 2025 as well with that. There's also the 10-day thyroid reset on my website. And you can also take my free health assessment, which looks at all the different pillars of health and which areas outside of thyroid. So thyroid is one of the pillars, but also will tell you, could your brain be being impacted? Could your gut be being impacted? So all those different areas, and it will give you a score for all of those. So they're all tools that you can use. Yeah, so I hope that's helpful. And of course, you can always reach out and contact me. I'm on Instagram. Details are on the screen. So at @good_health. You can jump to my website, or you can always email me as well. So I'm always happy to chat to people.
That's great. Thanks, Nicole. Like I said, I can't see that anyone else has got any questions from what's being discussed tonight. I think for those that joined late, just to let you know that the part 1 of Nicole's talk, which did for us earlier this year, will be uploaded onto our YouTube channel along with this second part. So it will cover all of the items, the gluten, the dairy, and all the things that can impact your health and how people respond. So it will cover all of those for those of you that are interested. It said, what's the title for your YouTube channel and the videos, please? It's the Thyroid Trust. So if you go onto YouTube and just type in the Thyroid Trust, you will be able to find us. We've got a whole heap in addition to like I say, Nicole's talks going on there. There are lots of other talks, some from medical professionals, endocrinologists, around lots of different subject matters in relations to thyroid health. And there's also some patient videos on there as well, people discussing their own experiences. So hopefully you'll find that a useful resource.